Hi, my name is Dr. Amee Daxini and I practice in my own clinic called Think Skin Clinic in Sarjapur, Bangalore. So stretch marks can never be completely cured. I begin with this because I want you to understand that there are certain things like scars, stretch marks where we have a permanent damage in the skin structure can never be completely treated. But yes, we can reduce the impact and we can reduce the way it looks and kind of merge it with the skin. Now let's go back to why stretch marks are caused. Whenever the skin expands or contracts immediately or very quickly, like in pregnancy, it expands from the 5th to 6th month onwards and then suddenly it contracts. Or post weightlifting or gymming, where you start using a lot of weights and suddenly the muscle expands and the skin expands with it. Now these sudden expansions and contractions cause one of the parts of our dermis or second layer called elastin to break. It's very simple, like if you have a rubber band and you stretch it, it's never going to come back to its original position or size that it was. It's always going to remain a little stretched. The same way is with elastin. So once it is stretched, you can't get it back to the original position. Stretch marks, when they are fresh, like just post-pregnancy, are a little darker in color, purplish to a little brown in color. And that's the time where we can actually work and treat it and get it more blended with the skin. Stretch marks which are a longer duration, say 2 or 3 years, they become lighter in color and it's difficult to blend them as much as the fresh stretch marks. So one advice is that the minute you notice stretch marks, do visit your dermatologist. Now what we do as doctors is we try and reduce the inflammation in that area and subsequently moisturize and help that place. I just want to tell you that home care remedies generally do not work. What ideally works is vitamin E works. There is a very nice herb called Centella asiatica which really works. And best is our vitamin A derivatives, that is retinols. We don't use retinols in pregnancy, but post that we can apply it on the skin, which will reduce the stretch mark thickness as well as the color. And subsequently, it becomes lighter, but it merges with the skin to some extent. So that's how stretch marks can be concealed, but we cannot treat stretch marks permanently.